There's something very special going on in Missouri, something you might never have even heard of. We'd like you to know about the mobile dental units, sponsored by the Elks Benevolent Trust, and providing free, high-quality dental care to people who might otherwise simply go without. We'd also like to give you the opportunity to help this program continue and even grow.
An elk is an American citizen who guides their course in life by the cardinal principles of our order. Charity being the first of those, justice, brotherly love, and fidelity. We put charity first because it is the most important thing, to take care of not only one another through the lodge, but to have an impact on your community, to make a difference.
The Elks were based on charity, founded on charity in the 1860s to help their fellow man.
To be an elk is to be able to associate with friends in a social setting while doing things to help your community.
To me, it means I'm part of the community. I'm part of what we do for the Elks in our charity work here.
It's the ability to love your brother man and just to have the opportunity to give.
As a state major charitable project in 1962, the state association formed the Benevolent Trust, which is an organization geared to charity.
Back in the 1960s, the Elks got involved with this program in providing dental services for this population group. Back then, they purchased trailers.
And they were about 10 to 15 foot long. They was converted to a dental office. They had problems with those, with freeze-ups and such as that. Then they went to motorhomes that was converted to dental offices. Again, still had maintenance problems and freeze-ups and things like that.
In the late 70s, when I got involved with the program, we shifted to self-propelled units so that we didn't have to depend on outside people to move the trailers from place to place, and we were able to expand the program to 3 units, and that was a big push and a big opportunity between the Department of Health and the Elks program. And for so many years this has worked so well. It's provided services for a lot of folks in a lot of places, and there's a lot of individuals out there that have better dentition and can eat and be more expressive with smiles and things because the Elks were involved.
And that's all evolved into the 4 motorhomes now that we use, that have 2 dental chairs, a dentist, and 1 and/or 2 dental assistants. The dental units travel around the state to the areas where the dental care is needed. There are many counties, especially in south central Missouri, who have no dental facilities or dentists who will perform these services.
It has been a tremendous asset not only to our agency but personally to my family. That's primarily because of the fact that there's such a shortage of dentists in the area that do accept Medicaid. And a lot of our disabled consumers were Medicaid eligible, therefore they were in need of certain services that are funded through Medicaid, and the dentistry part of it was one of the things that we just didn't have around here.
I started here about 45 years ago, and there came a time when, of course, dental health was, there just wasn't anything for people with disabilities.
But a lot of times it's, when they come here they haven't seen a dentist and they really need to, and it's something that's very much needed.
They actually showed me where all of my where some of the cavities were in my teeth, and they were really nice.
When I went to the dental van, they x-rayed my teeth, they looked at them and cleaned them.
They say you need to brush them 3 times a day.
Like this.
They cleaned our teeth, they checked our teeth, they showed us how to brush them and showed us how to clean them.
This is my son Shane. Shane has been going to the dental van for 10 or 12 years before
I even became a member of the Elks organization.
These are developmentally disabled children and adults that have a need to have dental care for them. We not only check them for routine dental problems, but we also coat their teeth with a substance to help prevent cavities.
And I've taken the young people there to the unit many times, and I'm always very, very impressed by the love and care that is shown by the workers and by the dentists that are in that unit. And I'll tell you, I just believe that when you deal with the young people that we deal with, that you're honestly dealing with the face of God.
We call it basic dental services. We do exams, we do cleanings, we do fillings, we pull abscessed teeth, sometimes we'll do a root canal for these folks. We don't do anything fancy. It's just the basics that they need to be comfortable and be able to eat and perhaps even speak a little better.
You know, they're always well taken care of. The doctors are very thorough. The dentist is very thorough with them. You know, he checks their medications. He has called us back and checked with us to make sure that everything is okay with some of them because of their health issues. You know, they're very thorough.
The dentist and his assistant are actually storing supplies that they use on these vans in their own homes. They do this free of charge. They do this out of the love of their heart for the program. And when you have an opportunity to speak to them, you can see the passion that they have for what they do.
I think all of them, the whole staff that we went to was very nice and treated us with respect.
We have some excellent dentists, have had excellent dentists on our dental units. They know how to relate to these individuals, and their dental assistants are the finest, bar none, anywhere.
The overall oral hygiene of our consumers has improved directly because of what Cindy and everybody with the dental unit is providing for our consumers.
And I liked the dentist because he was nice. Yeah.
Some dentists will just go in and do it and say, okay, this is what we're fixing to do. But the Elks, they will actually break it down and tell them, okay, well, we're going to do this, and then we're going to do this, and you let me know if you have any pain. You know, they're really patient with them, and they take their time with them. They don't try rushing through it. They make sure that they understand everything.
It really helped us a lot because the government and everything Medicaid and Medicare up, and we don't get they won't pay for no dental lab. And the only way we get dental lab is by the Elks Lodge.
They would have to wait, 4 or 5 months to save up the money to get the dental work done if it wasn't for the Elks to be able to come in and do it for nothing.
Pretty much nowhere.
Yeah,
pretty much
nowhere without the dental.
Yeah, that's the only option we have.
Wouldn't have to be able to go anywhere. Have to suffer with the pain.
They have no other place to go. And that's why we're so thankful for the Elks.
Our dental services have ranged from $250,000 to $930,000 in a year's time. That is dollar valuation of the dental care that we've provided. The most money that we have put in any one year into the dental program is $200,000. So that part is very cost effective.
One of the neatest things about this charity, if you will, is that for every dollar you donate, more than 90% of it is going directly to the dental unit. The administrative costs are very, very low. Unlike any other charity. I mean, the administrative cost of a lot of other charities is anywhere from 10 to 15 cents per dollar, and we're less than 5 cents per dollar in administrative cost. And that's the most amazing thing about this program.
I would like to see it get expanded where we could handle at least 3 units within the Elks.
I'd love to see us be able to find enough funds to get all 3 units back on the road again.
Well, obviously, first and foremost, I'd like to see it continue because of what it provides for people's special challenges.
I was telling what the dental unit does, and I saw the wife of one of our prospective members nudge her husband and say, "You're going to do that." I read her lips.
And I think the proof is in the pudding. You see the smiles after they're finished with any sort of dental work, whether it's just a cleaning or if they've had a cavity filled, whatever it might be, and they just beam, you know. And I think that's the best reward in the world, is just to see it on their faces.
When you can see a child smile or relieve them of pain, because many times some of these patients can't describe what's the matter, but they don't feel good and they've got a lot of pain. And when you know you have relieved that pain, that's a good feeling.
The best thing though was the smile on their faces after they got their teeth cleaned. I mean, they were so,
They bragged.
yeah, they bragged about it. They came home, they came home and bragged about having their teeth cleaned, and they had somewhere to go to have their teeth cleaned.
I liked it out. I liked it all the butter. And I had good time. Did have fun. Thank you, Elks Dental Lab. Thank you.
Thank
you
very much. Thank you.
Thank you.
Thank you.
Thank you.
Love you. Oh yeah, when we have that guy, he always clean my teeth very good.
You have now met just a few of the people served by the Elks mobile dental units. Often, the children and adults who use this program have nowhere else to turn for basic dental care. Here is how you can help. A pledge of just $100, payable at $10 per year for 10 years, goes directly to the services provided on the mobile dental units. Alternately, you could pledge $300, $500, or even $1,000, all payable over 10 years, which would be placed into a restricted account. The funds in this account are not spent. Only the interest is used to keep this important program going. Of course, you can also make a direct contribution to the Elks Benevolent Trust. Information on how to give can be found at www.elksmobiledental.org. Someone will smile because of you.
Proud of you. Your son's doing a wonderful job.
Yeah.